So welcome to this video audio. I'm not sure how you're going to be receiving this information, maybe on a podcast, but ultimately we are at Coach's Corner with myself, Rachel Frantz of Biomechanics Education, and also we've got Biomechanics coach TRACY Swindell. So this is Coach's Corner, where you can hear from professionals from the personal training, sports massage and Pilates world and industries about how they're nailing it. So welcome, TRACY. Thank you for coming on.
You're very welcome.
TRACY has been sort of within our fold for a couple of years, but can I take you back, TRACY, and ask you to talk to people about, well, introduce yourself, your profession, and how you first became involved in the industry you're in?
So I suppose I'm interested in fitness from an early age, really. I sort of did gymnastics as a child. Age 16, I started coaching it, and then stopped doing it myself, and then started running. Found that I was actually a much more talented runner than I was a gymnast, and then as a result of that, ended up being asked to coach a lot of runners. So I've kind of had to coach in there, bumbling along in the background. But I was an IT professional up until I had my children, which in 2010 I had a career break. It was kind of looking at what I could do. So I qualified as a PT in 2010, but didn't really start putting it into practice really until 2014, which is when I started looking at adding other skills to my skill set. I did Pilates. I also teach yoga, Pilates, and biomechanics, obviously.
And so, what would you call yourself now? I mean, do you have a kind of a profession you call yourself? Because you're pretty hybrid, aren't you?
Yes, it's a tricky one, and something I've quandered over a lot. And I usually say I'm a biomechanics coach, which usually follows with the question, a bio what? So, which I quite like, actually, because it gives me the opportunity to explain to people what I do and how I can help people. So quite often the conversation ends with, oh, I think I should come and see you. So that's always nice. So yeah, I usually say I'm a biomechanics coach, but I also PT. I teach Pilates and yoga, more one-to-ones. I only teach a couple of 3 classes a week I teach, which is quite nice. Yeah, I enjoy the classes, but I much prefer working one-to-one because I think it's so much more beneficial for the client. They can get so much more out of it.
Yeah, absolutely. So what do you think it was that kind of first made you look at and feel that the Biomechanics Coach Diploma was going to give you that edge? What was it?
Well, I suppose initially it was a little bit selfish. I was looking for, I've been to physios and things for myself, and I knew something wasn't quite right. I was having a few issues going on down my left side of my body, and I thought there had to be some connection with one injury causing another injury, and no one was really getting to the bottom of it. So initially it was kind of interest in myself, but then as I started working more, like from 2014 in the industry, I was seeing the same sort of thing with my clients and looking how they move, and I was like, I couldn't work out what was going on really in some of their bodies. So it was a case of finding out more, trying to get more knowledge really. So I've been doing a lot of research myself and stuff, and just when I saw the course I thought, I've got to do it really. So.
And I mean, you were talking earlier about when you tell people you're a biomechanics coach and they kind of a bio what do you think are the common misconceptions in the industry about biomechanics?
Well, I think people think biomechanics is just the alignment, how people look, so the extrinsic biomechanics, rather than the internal, the intrinsic biomechanics. And I think people, PTs often I see them trying to cue knee over toe, sort of things that possibly not actually, some people can't actually do that. They're not set up to do that. So if you're looking at the intrinsics, then you've got a clear picture of what they can and can't do. I mean, when people come to see me, they come to me for various reasons. They don't just come to me for biomechanics. They come to me, they say, oh, I want to strengthen my core. I want to, I want to be more flexible, all sorts of reasons. And basically, I insist that they have a screen before they do anything. I was like, because I can't work with somebody, I don't feel that it'd be professional to work with somebody without first assessing their body, assessing what moves they can do, what moves, how the body does actually move, and giving them the releases or the antispasms to allow their body the freedom of the movement, to allow them to move as well as they can be before we actually start training. So,
who's your typical demographic for you then, Tracy? Because, I guess human movement relates to pretty much anybody, but for you personally, who's your demographic?
It does, but I tend to rehab, really. So I get a lot of referrals from physios. We refer both ways, which is something that I've got from since I've had the confidence, really, and the knowledge to be able to talk to physios and feel confident when to refer to them. I'm working with a lot of people that a few years ago I would have there was no way I would have touched, because I would have been too nervous to do so. But now, having the backup of the group for biomechanics education, and also knowing that I can pick up the phone to physio, just gives me the confidence to be able to, I'm okay to work with this sort of person.
You get the guys, right? You get the guys post rehab, so they've been through the rehab with the physio.
So it can be all sorts. I mean, it might be somebody who's got hypermobility and they've got no stability in their core, and they need. But I was still, even if it's come from a physio, I still do the biomechanics assessment, do my own assessment, because if other things that show up, because we're looking at the whole body. Sometimes other things that show up, if they've been to the physio for a problem in their shoulder, they might not look at their pelvis, they might not look at their feet, or their, and how their step test, what their knees look like and stuff. So I always do the full assessment, and I just think sometimes other things get picked up that may have otherwise been missed, and it's just better for the client, really.
It's nice to be able to set up that referral. So do you feel like you got to speak to these guys from kind of like understanding the biomechanics program better?
Oh, definitely, yeah. I mean, I've got a couple of GPs that refer to me. I've got an osteopath that refers. So I think, yeah, it's good for everybody. It's good for the client ultimately. But yeah, sorry.
It's vital, isn't it, that we have this communication, because I think it's something that's been missing in this gap between the sort of physiotherapy clinical world and then the exercise world that needs to be filled. So it sounds like you're really filling that gap, Tracy.
Yeah, I mean, I've got a GP. She's been with me for a couple of years training, and she said she's really frustrated with her job, because she knows that if what I did was on the NHS, she'd be referring them to me rather than sometimes having to refer them. She hasn't got anywhere else to send people. She's sending them to the consultant, whose their toolbox is surgery, really, or physio or surgery. So she would really like to get involved and help sort of promote the intrinsic biomechanics more, because she's seen direct results of it. She's got a partial ACL tear in her knee, and she wanted to avoid an operation, and she's doing so much more than she was able to do before. She used to hobble in, and now she's very into her fitness, which is new for her as well. Yeah. So yeah.
I mean, I guess the big question is, how's your biomechanics? You ultimately did the course to look after yourself, and you're helping all these people, and you've got great connections. How about you? How are you doing?
Yeah, I mean, no issues around my pelvis and down my left side, which is what I started with. I still get a little bit of upper back issues, but that's usually when I've not done my releases. So, it's practice what you preach, isn't it?
I mean, I guess... Go on, sorry, carry on.
As I say, if you don't do what you know that your body needs, or I'm so much more in tune with my body, and I know if I've not done my releases, or I need to do some strength work, or whatever I need, I just know what it needs now, rather than just sort of doing the same thing. I used to just run, coming from a running background. I used to just run and not much else, really. A little bit of strength work, core work, strength work, but not much else. So I
So
appreciate your value.
can you give us an example then of a client that, you know, you took through the program? Have you got somebody, obviously without any of their personal details, and how it's helped maybe a specific client? Can you give us an example of that?
Yeah, I've got a few, but one that particularly like to talk to is 83, which is lovely. She said to me that she wanted to be more flexible, and she said it was quite funny because I asked her for a goal, and she said that she could always put her foot in the sink to wash her feet, which I thought was quite funny, really. And she said I actually can't do it anymore. So I was like, okay. So anyway, we looked to see how close she was to doing it, and then we went through the system, and we actually highlighted that she has got a problem with one of her hips, and I did have to refer her to the physio, but she can now do it with the other leg, so the good leg she can actually get into the sink, which is quite funny. And the other thing she did report was that she's now able to go up and down the stairs much more easily, much more confidently. So she said she would never have done that without holding on. She can now walk up and down stairs without holding on. So that's quite a lovely one, really.
It's not all about the race, is it? And the timing and
no, definitely not.
spotting. It is very often, just about.
I mean, the age range of people that I see is quite different, really. I've got I have sort of sometimes dancers come to me, which are obviously quite young. It just depends, really. It's not really age specific. I think I do find the people that probably maybe late 30s, 40s and older tend to be better with their homework. They can really, they're much more committed, whereas I guess the younger people are just like I used to be, really. Get out and run, get out and do their sport and not worry about what's happening in their body too much, whereas the older people, I think, realise they want their body to be and be able to do their sport or whatever it is they're trying to do. They want to be able to do it for a long period of time, so realise the value, I guess.
And I
guess you speak.
I was just going to say, I guess that movement is for everybody, you know, healthy movement. And children are sort of sitting at desks and playing on computers, and the challenge is about getting them, you know, to do the exercises or to help them improve movement or just understanding it. Do you have any other examples, like maybe, so you've got your 83-year-old, of the sort of a kind of a different end of the scale?
I've got a guy, it's not a guy who came to me from, again, well, this one was via a physio to help stabilise. He was quite mobile. He's a keen cyclist, but spent a lot of time driving. And when I assessed him, he was very, very mobile. So nobody had really picked up, other than the fact he was hypermobile. But what I did pick up, there was asymmetries. So we find those out, which didn't take very long at all. And I asked him for a review, and I was quite surprised when he wrote that he'd had back pain for 20 years. He hadn't mentioned that. He'd had back pain for 20 years, which he hasn't got anymore. So that was, again, quite lovely again. So, but he hadn't told me that. He just said, oh, I need to do some core work. The physio said I need to do some core work to strengthen up my core. And I was like, okay, let's do the assessment first. Which is why it just shows the importance of doing that assessment, because otherwise I would have just done the core work with him and the asymmetries wouldn't have been picked up.
And how long does an assessment take in your kind of setup, the way you deliver it, Tracy? How long does that take?
I'll probably spend about an hour with them, but not because the assessment takes that long. It's because I've got like a long question and I try to spend, I don't know, 20, 30 minutes maybe, even just talking. It's probably the assessment itself, maybe 20 minutes, half an hour. But so it's more sort of trying to get to know the person, trying to identify their goal, really, what they want to be, because I don't like the goal to be, or as biomechanics coach, we don't want the goal to be remove pain. And obviously a lot of my clients are coming with pain, but I don't want that to be the goal. I want the goal to be a movement goal, or get back to doing whatever it is that they can't do now. So it's trying to nail that really with them, and you know, I'm usually very clear with them that I don't promise that we can remove the pain.
Yeah. So what do you think, when you came through sort of the academy with us and you were in that learning curve, what do you think the best thing was for you prior to sort of going and applying it in terms of coming through the program? You've talked a lot about, you know, the community and being able to call, and obviously the memberships and the Intrinsic Biomechanics Association. But what for you is kind of the best part of it all?
To be able to practice on other people in an environment where you won't be judged. To be able to find out about my own body. It's lovely to be able to have someone to assess you, because to a degree you can assess yourself, but it's so much better when someone else is doing it for you. Just think the workshops and a lovely environment to learn in, really open. You learn so much more than just the content of the course. The open discussions with other professionals, different viewpoints. You know, it's okay to have a different view, and that dreaded question, why?
So what?
Yeah, so what? Why?
Okay, so I mean, you've been really great, Tracy. I've worked with you for several years now in terms of obviously through the academy and then you get yourself set up, and you've sent us through feedback about, there was one you said sort of as you come towards the end of your training, you had a fab couple of days, really buzzing from it, already thinking about how you're going to use it moving forward, can't wait to get started and put it into practice. But then you sent another one, and you're actually talking about, I believe you left a commercial gym and doubled your salary within a year, and then you were predicting to triple it. Can you just explain a little bit about that?
Yeah, I mean, the gym, it was very difficult to earn money there, as anyone's worked in a commercial gym will know, whether you work on paying ground rent or whether you work on, I used to work on the tier system, so you get a very, very small percentage for what you were earning. But I guess the main thing that I got from the course in terms of leaving the gym was confidence. I just felt that, I was looking around and thinking, I'm offering so much more than these other guys here are offering. I just can't stay here anymore. It wasn't really so scary to leave anymore, because I'd come from a place where I guess I've never been a hugely confident person. So I'd come from a place where you know, my first job in the gym was, I don't know, getting out there for me, I guess. And then it was just a bit of a no-brainer to leave. It wasn't really that difficult. I mean, of course, it was a little bit nervous, but at the end of the day, I could have always gone back. So, but I haven't looked back, to be honest, and I wouldn't go back. Yeah. So as much as I like freelancing now, I do freelance there still, which is a win-win, because I earn more money freelancing. I still get to see all the lovely clients and members that I saw before. So yeah, no, it's all good.
And I remember one thing that struck me about you, Tracy, when I first met you, was how, from my opinion as a trainer, was how knowledgeable you were, and yet how reticent you were in some ways about how much you knew. You kind of like had a go, you would ask great questions, and I saw you as being super knowledgeable, but I wasn't sure if you actually realised how smart you were, and then as you've gone through this diploma, it's actually come through more and more. So the talk about the confidence thing, I think is quite important, I guess, for other people listening.
Absolutely. I mean, I would say that is the biggest thing for me, definitely. I mean, you say I was smart. I wouldn't even say I was smart now, to be honest, but confidence huge. I guess I was always interested and always did my own research about things, so maybe that's why you thought I was smart, but I didn't have it backed up with anything. It was just reading books and no practical knowledge. It was all just what I'd found out for myself. So to have someone say to me, oh, this is how the body works, do this, do that, and I'm like, oh, okay, so I already know that, and now you're telling me that. And then the questions were just bringing it all together, really. So, even though I felt, in some ways I felt that I did know some things, but I didn't have that confidence or the backup, I guess. with any formal education.
Yeah, and I find it interesting actually, because I mean, it sounds like you're like me, where you come from a background thinking, well, you're not that smart, but you like working with people, and you have this perception of your own intelligence, and yet, you were helping people. But what you're doing now is helping even more people in a more thorough, more wider kind of like interdisciplinary practice. And I think it's a huge thing to realize what you're doing is you're helping a lot of people with that perception of ourselves. I find that fascinating. I'm included in that. I'm with you. I kind of empathize with you. I haven't done a degree. I've never been to university, and yet look at what we're doing in terms of application and practical knowledge of helping people move better, right?
Yeah, definitely. And I can remember you saying that, I'm not an academic. And I used to listen to you and think, how can she say she's not clever, she's not academic? I'm like, she so is.
But I'm like you, self-taught. It's that self-reading. But then when you have a program like the Biomechanics Coach Diploma, what it does, it's extremely simple, but we're talking about this complex thing that is our body. And yet that simple application makes you realise, actually, it is that simple. We have our Kubler-Ross curves where you go into that stage 2 of confusion, why and how, but you just come out the other end, don't you, and realise actually it is about helping all these people.
And I think that's what the community helps with as well. You sort of, it's a sounding board, if you're not sure. I know in the early days I used to post a lot into the group, and you used to say, you answer your own questions. But sometimes I needed to slow my brain down, because I was always chasing ahead, overthinking things, maybe even slowing it down to. But if I didn't get the answer, there was always someone in there that could say, well, have you thought of this? Have you thought of that? Look at things in a different way. So it's a great forum as well as the course. The forum is great. The Facebook group is great as well. Lots of different people in there, very helpful.
Yeah, it's a good community. So what would you say to somebody, if anybody listening is kind of wondering about joining us in the academy, what would you say to them right now?
If they're interested in the human body and how it moves, you've got to do it. It's not just about the workshops, it's the continued learning, the path. If you've been out of education for a while, it's set me on the path of education, really. It's not just those workshops, it's the discovery days as well are great. You learn so much more than just workshops, talking to other professionals from different skill sets, seeing how other people, other biomechanics are applying it. I'd just say do it, because it opens so many doors for me, and I just feel like I'm building, even now I'm still learning all the time. Sort of, I've just got that thirst for learning, and I realised just how much I didn't know before, and which is great, because it's exciting, because I know that I'll be a better biomechanics coach next year than I am this year, and the year after I'll still be better, because it's a continual journey. And just do it. Just sign up. You won't regret it. So
if there's anybody out there who is, whereabouts are you based again, Tracy?
I'm in Essex.
If there's somebody in Essex who's listening in and they're saying, well, I wonder what this is all about, I wouldn't mind coming to see Tracy for an assessment, how can they get hold of you? Have you got a website or something?
I've got a website, onebodycoach.com. I'm also on Facebook page, again, One Body Coach. My number's on there. Just get in touch. Email address as well. So just get in touch. I'm also on the biomechanics coaching. You've got a map, haven't you?
Yes.
And that's for all the biomechanics coaches. I can be found on there as well.
Yeah, so Tracy is a registered, an IBA registered biomechanics coach, guys. So you can find her on the biomechanicseducation.com website. If you go to the contact page, follow down to the map, and you can find her there, or through both of the mediums she's just given you. So Tracy, thank you so much for sharing your journey with the people listening. And I'm going to be seeing you, I think, in a couple of weeks at one of these discovery days, aren't I?
Will do, yes, on the 15th, I believe. Yep. Looking forward to it.
Well then, so thank you so much, Tracy. So guys, check it out on the Biomechanics Education website. Do get in touch if you've got any more questions. We've got another Coaches Corner coming soon, so let us know if you've got any questions or any feedback. And thank you very much. Thanks, Tracy.
It's a great pleasure.